Welcome, and thank you for watching this webinar on the THN onboarding process for new ESG subrecipients. First, I want to say congratulations to as being a new ESG subrecipient. We're excited to be working with you on this project. We'll go through the agenda now. So first we'll look at objectives for this webinar. We'll then talk about the Texas Balance of State Continuum of Care and THN's role within it. We'll look at the overall onboarding process. We'll then discuss some of the more detailed parts of that onboarding process. We'll look at coordinated entry, HMIS, the local homeless coalitions, point in time and housing inventory count, and the ESG program. So our objectives for this webinar are to understand who THN is and our role related to the ESG program, to also understand THN's onboarding process, and for you guys to have a sense of what steps your organization has already completed in this onboarding process. So as we go through the steps within the onboarding process, just reflect on what you feel like your organization may have already done. So let's talk about what the balance of state is and THN's role within it. We'll start by explaining what a continuum of care is. So a continuum of care is a collaborative approach to planning and funding. Continuum of care refers to not only HUD's COC program, but also the geographical region covered by a COC program and the body of people that participate in homeless services within the geographic area, including service providers, advocates, local government officials, community members. There are 11 COCs in Texas. You can see on this map that each COC is a different color and then each one has a different size. So what is the purpose of HUD's COC program? The HUD COC program is governed by the HERTH Act amendment to the McKinney-Vento Homeless Assistance Act of 2009. The HERTH Act says that the purpose of a COC is to promote access to and effective utilization of mainstream programs and programs funded with state or local resources, to promote a community-wide commitment to the goal of ending homelessness, to provide funding for efforts by nonprofit providers and state and local governments to quickly rehouse homeless individuals and families while minimizing the trauma and dislocation caused to individuals, families, and communities by homelessness, and to optimize self-sufficiency among individuals and families experiencing homelessness. As the COC and HMIS lead agencies and collaborative applicant, which we'll explain more about this later, THN works to accomplish this purpose by assisting the COC with completing activities legislatively mandated by the Continuum of Care program interim rule, including establishing a planning body and leadership structure for the COC, administering and operating HMIS, conducting COC planning and operations, facilitating the application for federal Continuum of Care program funds, and sometimes coordinate ESG program application recommendations for the Texas Balance of State Continuum of Care. And so what is the balance of state exactly? Balance of state. The Balance of State Continuum of Care is a COC that exists in parts of a state that are not covered by other COCs that are usually centered around an urban area. Because the creation of a COC requires the cooperation of a lead agency that has administrative resources, many rural and suburban areas that lack the infrastructure needed to form a COC can't receive HUD Continuum of Care program funding. So in 2006, the Balance of State Continuum of Care was created in Texas in response to this problem. Establishing a Balance of State Continuum of Care enables agencies in the area of the state that were not covered by their own COC or had never been under the governance of a COC to apply for Continuum of Care program funding. So the Texas Balance of State Continuum of Care is the largest of the 11 COCs in Texas. It covers 215 of Texas's 254 counties. You can see it's there in orange on the map. But because it's so large, it presents certain challenges to serving the homeless population. We have a large geography, which means there's varying demographics within different areas that present different needs. It's also decentralized, and service providers are often working in isolation, not able to coordinate with other service providers, or there not being other service providers in the area. And so each area may also have different resources and stakeholders available to engage in this work, which means they have different strengths and different challenges as well. And when we look at housing affordability, you'll see that it varies across the state as well. And what is available for that housing affordability is different as well. So now let's look at what THN's role is in the Texas Balance of State Continuum of Care. First, let's look at the general membership. So let's look at what is considered a general member of the Texas Balance of State Continuum of Care. In our Continuum of Care, general members act as the primary drivers of COC activities in accordance with HUD guidelines. So a general member refers to anyone who lives and or works within the COC and has an interest in preventing and ending homelessness. Some COCs restrict membership to those that meet certain criteria, such as paying annual dues or participating in general body meetings. However, the Texas Balance of State Continuum of Care has open membership, meaning that all those wishing to participate in COC activities are able to do so. COC general members elect representatives in the form of the COC board and committee members to make decisions about COC activities on their behalf. You can see those represented in the top right square and the bottom left right square. So before we talk about THN's role, let's talk about who THN is. THN is an advocacy organization that was incorporated in 1991 to work towards ending and preventing homelessness around the state. In 1995, the Texas Interagency Council for the Homeless, also known as TICH, was created by the state to address the lack of COC funding in rural areas. THN received funding to help the TICH fulfill its legislative mandates. THN later became the lead agency for the Texas Balance of State Continuum of Care at the request of the COC's board. And so through a memorandum of understanding between the COC board and the THN board, THN helps Continuum of Care members to meet requirements, develop housing crisis response systems, implement best practices, and achieve high performance so that homelessness is prevented when possible, and when it occurs, it is rare, brief, and non-recurring. And so THN has a few different responsibilities in these different roles. So as the lead agency, THN is responsible for supporting COC planning, operations, and data collection. It's tasked with assisting the COC board in ensuring that all of the COC requirements are fulfilled. Now, THN also acts as the collaborative applicant. And so, under agreement with TDHCA, THN facilitates the COC grant application for the Texas Balance of State Continuum of Care. And sometimes THN acts as the ESG grant coordinator for the Texas Balance of State Continuum of Care. And in this process, THN facilitates the grant application and makes recommendations to TDHCA for the ESG funds. And lastly, THN acts as the HMIS lead agency. This agency is tasked with hosting, managing, and supporting the use of HMIS for subrecipients in the COC. So up until now, you've engaged with THN as the ESG grant coordinator. After this, and from now on, you'll start to engage THN in its role as a COC lead agency and HMIS lead agency. Now let's briefly look at the general overall onboarding process. So there's 5 main overall steps in this onboarding process. The first one is to begin to understand and the implementation of coordinated entry. After that, you'll work on getting HMIS training and the system set up. You'll then connect to an existing or start to work on starting a local homeless coalition. After that, you'll look at understanding the point in time count and the housing inventory counts, and get connected to any local PIT leads. And the last step within this is to verify that your ESG program written standards adhere to the Texas Balance of State Continuum of Care written standards for delivery. Now, these are all just the high-level main areas and steps, and each of these areas will have their own individual sub-steps. And again, I want to emphasize that These steps aren't necessarily linear. Some of them may happen simultaneously, but our main goal is to not overload you with too much information at the same time. So as much as possible, we'll step you through them. And so how will this onboarding process work? The first step is going to be to identify which steps in our onboarding process have already been completed by your agency. This is something THN will facilitate. Once we've identified which of these steps have already been completed, THN will identify what is the first step that needs to be started for your agency. From there, the appropriate THN team member will contact you to initiate this first step. And then from there, there'll be follow-up from subsequent THN team members for each of the following needed onboarding steps. So for example, your agency, there already may be a coordinated entry implemented in your area. There may already be a local homeless coalition. So the steps that you'll be involved with for those areas will be minimal. And so now let's start to look at coordinated entry. I'll pass this off to Katie.
Hello. Coordinated entry is defined by HUD as a process developed to ensure that all people experiencing a housing crisis have fair and equal access and are quickly identified, assessed, referred, and connected to housing and assistance based on their strengths and needs. The forming components of the coordinated entry process are access, assessment, referrals, and prioritization. These are woven into the definition of coordinated entry. According to USICH, which is coordinated entry is a process through which people at risk or experiencing homelessness can access resources and a housing crisis response system in a streamlined way, have their strengths and needs quickly assessed using a standardized assessment tool and practices, are referred to appropriate housing and mainstream services tailored to their needs, while the most intensive interventions are prioritized for those with the highest needs. Because the Texas Balance of State Continuum of Care covers such a large geographic area, our coordinated entry process is broken up into 17 plus regions. Each region operates their own coordinated entry process. The systems change team at THN oversees and supports all of the regions and their individual processes, along with the coordinated entry steering committee, which has one representative from each region. This committee serves as the governing body for coordinated entry and the Texas Balance of State Continuum of Care. The coordinated entry planning entities are comprised of one representative from each participating agency in a region, and they manage the day-to-day process of coordinated entry in that region. There are two main types of participating agencies in coordinated entry. The first is entry points. Entry points are where the initial assessment occurs and where the assessor will make housing and/or supportive services referrals for a household experiencing a housing crisis. Receiving agencies are the housing projects that will receive coordinated entry referrals to fill their project openings. Receiving agencies must follow the referral and prioritization standards as outlined in the coordinated entry written standards and the region's coordinated entry policies and procedures. So the first question to ask when getting involved with coordinated entry is there already a process in place in your area? There may be one or more organizations in your area that already participate in coordinated entry, and your organization could join their process either as a new entry point, a receiving agency, or both. If you aren't sure if there's already a process in your area, THN will be able to let you know, and we can help you get in contact with your local planning entity. To join an existing coordinated entry region, first contact your coordinated entry planning entity. They will then approve the organization as a new participating agency in their process. The next step would be to sign the Memorandum of Understanding, agreeing to be a participating agency in your region's coordinated entry process. Third, we would need to determine if your agency already uses HMIS for their housing project. If they do, they can move on to requesting coordinated entry specific HMIS training. If your organization does not yet have HMIS, they would need to fill out an HMIS new agency application and complete additional HMIS training before the coordinated entry HMIS training. If there is no existing coordinated entry process in your area, Your agency will follow these steps to start a new process. The systems change team will also be in touch with you to guide you through this process in detail. The first step is to host a series of coordinated entry kickoff meetings with organizations that are part of the local housing crisis response system or local homeless coalition. We can really dive into how coordinated entry works and what it means to be involved in the process. The next step is to determine which organizations will act as entry points and receiving agencies in your region. Also to form a coordinated entry planning entity. There should be one representative from each organization that will be participating in coordinated entry. Next, the coordinated entry planning entity will complete drafts of the governance documents and request training for the participating agencies. The systems change team at THN will work with the coordinated entry planning entity to revise or edit the governance documents until they are finalized. All participating agencies will complete their training within 30 days. Once the governance documents are ready and training is complete, the region will choose a launch date to begin assessing, referring, and receiving households through coordinated entry.
Now we're going to talk a little bit about the Homeless Management Information System, more commonly referred to as HMIS. HMIS is a computerized data collection tool specifically designed to capture client-level information over time. It collects information on the characteristics and service needs of individuals and families experiencing homelessness and the services provided to those clients. HMIS is the system you will use to facilitate coordinated entry as well as your agency's ESG funded programs, to enter data for the clients you are serving in your program, and to collect the data needed for required reporting. If you aren't currently using HMIS, we will work with you to get your organization set up in HMIS, and once you determine who will be entering clients in the system, both for CE and your specific programs, we will ensure that everyone is trained on how to properly use the HMIS system. If your agency is currently using HMIS, there may be additional setups and/or training needed to ensure that everyone understands the CE workflow and to get any new programs you may have ready for you to be able to serve clients. We will be getting with each of you individually to determine what, if anything, needs to be done in regards to HMIS setup and training. We will also provide you with the details behind the cost associated with HMIS so that you can include that in your planning. Domestic violence providers will not be entering data into HMIS. They will be using a comparable database, which will be discussed with you separately. Now Lindsay is going to talk about training.
Hello, my name is Lindsay. I'm the HMIS Training Coordinator at THN. I wanted to briefly talk about the HMIS training process and then walk you through what that's going to look like. So if your agency does not currently have access to HMIS, you will need to fill out a number of forms to get set up in the system and to ensure that our training coordinator sends over the appropriate training materials. We've created an HMIS checklist PDF, which I'm going to look at in just a second, and we will send that out to everyone so that you have everything you could possibly need to get started with HMIS. This document has all the relevant forms that you'll need, regardless of if this is your agency's first time using the system or if you currently use the system but you need to add new programs or even maybe a new user. This email address will also be on the HMIS checklist, but if you have any HMIS related questions, you can send those to the HMIS help desk at hmis@thn.org. We're going to quickly walk through the HMIS checklist. Okay, so this is what that HMIS checklist is going to look like. You'll see this first section is called the THN HMIS New Agency Application. So this is the first step of the process in terms of getting started with HMIS. This only needs to be done one time per agency. And this form basically helps the HMIS team understand exactly how you'll be using the system so that your programs can be correctly set up in the system. Also included in this form is the agency agreement form, which explains all of your responsibilities as a participating agency. Again, this only needs to be done one time per agency. And once you fill out that first form, we will basically send you everything else that you need, so you don't really need to be proactive with anything else, we'll send you all the other forms, but I just wanted to be transparent and let you know a little bit more about what this system looks like. So after your agency's application has been approved by the HMIS team, you will receive a link to the HMIS Training Request form. This form is sort of on the user level, so this form must be submitted for each person that needs to use HMIS, and this is the starting point for that individual person's training. Shortly after this form is submitted, the trainee will receive instructions on how to begin HMIS training, and then moving forward as an agency, you can complete this form for any new users that need HMIS training in the future. One other thing, HMIS administrators. So every agency in HMIS must have one person that is dedicated as the HMIS administrator for that agency. This person must be an active HMIS user, and their primary role is to be the main point of contact between their agency and the HMIS team. There are a number of other responsibilities that the HMIS administrator has, and we've devised a short 1 hour long training video that we'll send to you once you identify who that admin will be at your agency, and that will explain more about their roles and responsibilities. They'll also have to submit an HMIS administrator agreement form, which again we will send to you. And then this bottom section, existing HMIS agencies, this is for those agencies that currently have access to HMIS, but maybe they need to put in a new program into the system. So you will want to fill out the new HMIS program request form, and that will give us all the information we need to get that new program set up in the system correctly. And then in the further reading section, at the top you'll see we have an HMIS FAQ. This takes you to a page on THN's website where it explains how much HMIS costs per user, what the billing process looks like, how it's prorated throughout the year. All of those cost questions can be answered there. And then next to that, on the right-hand column, we have the HMIS Training Process Guide. So this kind of walks you through what the training process looks like for each individual HMIS user. Again, our training coordinator will send you everything you need, but this is just so that we can be transparent about what you're getting yourself into. And then the last 4 links are not required reading, but if you do want to dive into the nitty-gritty of HMIS, we have the data quality plan, the client privacy notice, the policies and procedures, and the privacy policy. And again, if you do have any questions that aren't answered on this form, you can email us at hmis@thn.org. All right, so now I'm going to pass things along.
Now we're going to dive into local homeless coalitions, also known as LHCs. Local homeless coalitions are groups that work to address homelessness in a designated geographic location, such as a city, county, or cluster of counties. The Texas Balance of State Continuum of Care's massive size makes local homeless coalitions essential partners in carrying out the necessary community-level work needed to prevent and end homelessness. A local homeless coalition is an organization comprised of agencies representing various community sectors. Those that serve or come into contact with people experiencing homelessness, those whose policies impact the lives of the unhoused, those that want to advocate for homeless individuals, and those that are currently experiencing or have experienced homelessness themselves are encouraged to participate. The primary purpose of a local homeless coalition is to provide a platform for communities to develop a bird's eye view of homelessness, as well as the resources in place to meet their immediate needs and the system in place to end individual homelessness. LHCs also analyze the systems in place that cause homelessness. These analyses allow for the formation of coordinated community responses through activities like service deduplication and gaps analysis. Creating this platform for coordination empowers organizations within a community to have a collective impact on making homelessness rare, brief, and non-recurring. If an LHC exists in your community, your agency, as a subrecipient, is required to regularly attend meetings so that you can stay up to date with local resources and developments, as well as ensure as many community partners as possible are aware of the assistance available to clients. To help coalitions be client-centered agents of change, representation from those able to finalize decisions and those that work directly with clients are strongly encouraged to attend. To join your area local homeless coalition or learn how to start a coalition in your community, contact lhc@thn.org.
Hello, everyone. My name is Kira Henderson, and I'm the data coordinator here at Texas Homeless Network. What that means is my role is to coordinate the annual point-in-time count, the housing inventory count, and then I also respond to internal and external data requests as needed. So for those of you who are unfamiliar with what the point-in-time count is, the point-in-time count is an unduplicated count on a single night of the people in a community who are experiencing homelessness. The less technical definition I like to use is that the PIT count is a snapshot of the minimum number of individuals in your community experiencing homelessness at any given time. The reasoning behind the PIT can be broken down into 4 main buckets. Awareness, which can be viewed both at a community outreach level as well as with your local governments. Extent, which means the characteristics of those experiencing homelessness in your community, as well as what trends your area might be seeing over time. Funding, and for those of you who have been in any of my trainings before, you've heard me talk about this one key fact, or you'll get very used to hearing me talk about this one key fact. If you are going to be requesting funding, whether it be federal, local government funding, or private funding, the first question you're going to be asked is the scope of the problem. If you don't know how large the need is, you don't know how much money is necessary. This is the one tool that is used nationally to illustrate the need. And finally, engagement. Not only is this an incredible opportunity to create a sense of shared responsibility with local leaders and stakeholders, but it also provides the opportunity for you to meet with the folks experiencing homelessness in your community to help foster strong relationships. For anyone who has read an article about homelessness or seen a policy referencing the number of people experiencing homelessness, the PIT count is the tool that was used to gather that information on the scope of the problem. In essence, these next 2 slides give you the primary requirements of the PIT count. The individuals counted are those residing in unsheltered locations, such as streets, cars, outdoor encampments, and places not meant for human habitation, as well as those residing in sheltered locations. Our formal sheltered locations are emergency shelters, domestic violence shelters, and transitional housing projects. The PIT also gathers information on informal shelters, such as hotels paid for with an agency voucher. As a note, in conjunction with participating in the point-in-time count, those formal sheltered locations in the middle also need to participate in the housing inventory count. The housing inventory count, also known as the HIC, occurs at the same time as the point-in-time count. While the PIT gathers information on the number of individuals experiencing homelessness, the housing inventory count is used to gather inventory information on the shelters reserved for those experiencing homelessness. The PIT and the HIC work together to show the comprehensive picture of your community needs and your capacity to respond to those needs. One quick tip, the HIC gathers information from all project types. So this includes the formal project types listed on this slide, in addition to permanent supportive housing projects and rapid rehousing projects. If you represent an agency that fits the criteria to participate in the housing inventory count and/or the PIT count, you will be contacted in the following months with instructions on how to submit your data to us. So now that we've gone over who does count for the point-in-time count and housing inventory count, the ones who do not count are those residing in permanent housing, such as PSH, rapid rehousing, VASH, or FEMA projects. We also do not count those residing in temporary locations, such as couch surfing with friends or family, or hotels paid for with their own funds. Additionally, we do not count those residing in public health or criminal justice facilities. And as a note, these are not our guidelines, these are HUD guidelines, and we are required to abide by them in order to participate in the PIT count. So what are your next steps? Most of you are not serving as your local point-in-time count lead, so your first step is getting in contact with your local leads regarding any meetings or trainings they have scheduled. If you do not already know who your local PIT count lead is, please contact me directly, and my contact information is on this slide so that I can put you in touch with them.
The next step is going to be watching the volunteer training video, which is hyperlinked on this slide. And then finally, regularly looking at the THN website to gain access to the most up-to-date training materials and resources. And now I'm going to pass it off.
So now we're going to look at the last part of the onboarding process, which is to look at your ESG program. So for this part of the onboarding process, this is specific to verifying that your ESG program written standards adhere to the Texas Balance of State Continuum of Care written standards for service delivery. So one thing I want to clarify too is again, like, where's THN's role within the ESG program? So first, let's clarify what TDHCA's role is. So TDHCA is the organization, the agency that you have the contract with, and they're going to be your primary contact for questions about contract requirements and commitments and adhering to the ESG CFR specifications such as eligible costs. That's usually the most common question that comes up regarding this, and those are the sorts of questions that you should go to TDHCA for, and if you ask us, we'll refer you to TDHCA. Questions that would be best to go to THN for, where we're the primary contact, are those that are about the Texas Balance of State Continuum of Care requirements for ESG projects, like implementing coordinated entry, HMIS, the PIT and HIT counts, a local homeless coalition, and the ESG program written standards, all the things that we've discussed thus far in this webinar. THN can also provide additional support in designing the best practices in the ESG programs and formalizing them within your program written standards. So these program written standards they document the policies and procedures for addressing homelessness within your program. They also will formalize best practices in this documented policy. The written standards must adhere, as mentioned before, to the ESG CFR requirements, as well as the Texas Balance of State Continuum of Care written standards for service delivery, as we've mentioned before. And it's that last one that we're going to focus on in this part of the onboarding process. How can THN support you beyond the onboarding process? So after the onboarding process, THN will be available to you to provide technical assistance if you ever need to update or change your written standards. Again, we're here to support you to make sure that they continue to adhere to the Texas Balance of State Continuum of Care's written standards for service delivery. We also can provide technical assistance on the best practices for ESG programming, like Housing First, low barrier projects, racial equity, and other such best practices in providing homeless services. We also can help provide support in how to utilize the CDC's COVID-19 guidelines within your programs. So the overall the process regarding the ESG written standards are that your agency will need to send the written standards to THN. Now, some of y'all, or you've all submitted those to in your grant application, but sometimes those get updated during the contract process with TDHCA, and so if you've had to update your written standards in that contract process, we'll need to get the copy of those updated written standards. Once we receive a copy of your written standards, we'll have a chance to review them, make sure that they adhere to the COC's written standards. And if we have any feedback where we feel like there's some updates that need to be made, we'll send that back to you. And you'll have a chance to update them, get them approved by your board again, and then resubmit them again to TDHCA. So this is just a resource page for you. These are links where you can go and see the ESG CFR written standards requirements, as well as our Texas Balance of State written standards for service delivery. This last link is THN's general page on our website for the ESG programs. And if you have any questions about this, you can contact me. My name is Jana Sims, and you can see my email and phone number there on the screen. So we want to thank you for watching this webinar. I know it's been a lot of information that's been thrown at you, but don't worry, we're going to walk you through this process. You don't have to memorize this all. We're going to be here for you, and we'll step you through and pass you on to the next pieces as we move along in this process. If you received this email, if you received an email that brought you here with instructions for what to do after watching this, please refer back to that email for the next steps in your THN onboarding process. Have a wonderful day. Thank you.